Hello, I'm Dr. Kowalski, Chief of Department of Bariatric and Metabolic Surgery in KCM Clinic in Jelenia Góra. What do you mean when you think about the bariatric surgery? The most popular procedures of bariatric surgery is sleeve resection and gastric bypass. This is a very popular and very safety procedure because the complication is, I think, about 1 to 2% of our patients after these operations. Sleeve resection, sleeve gastrectomy is the bariatric procedures who get the two effects of restriction effects, because we get the new stomach. The new stomach who likes like this, and we get out maybe about 80–85% of the stomach. This is the removing portion of the stomach, and the second effect is the effect of the hormonal effect, because we get this part of stomach who produce ghrelin. The difference with the gastric bypass. Gastric bypass get the two parts of the stomach, a little pouch like here. This little pouch is about 15 milliliters, and this is the stapler line, and this is we lose in the patient the parts of the stomach. We get the two effects, metabolic effects too. The first effects is the restriction effects, like in the sleeve resection. This is the little pouch, and the second effect is we get the unabsorbable part of intestinum. This is the no absorbable part of intestinum. Maybe about 100–150 centimeters from the duodenum, like here. What's the procedure is the best for I think sleeve resection and gastric bypass. This is the very good procedure, but not for every patients. For the start and for the young people, most effective and most safety procedure is the sleeve resection, because after this procedure we can do the gastric bypass. After the gastric bypass we can do nothing. Sometimes we try do the rare gastric bypass, but the effect after this operation is we don't know, like we can the effects. Gastric bypass is good procedure for the metabolic complication. For example, for the diabetes. For this patient, gastric bypass we must do like the first. and for the people who get the medical problems, like problems with the hypertension and the others, but no goes to get this problem with the medicamentation. Sleeve resection is the very safe and very good procedure for all of these people, but we must remember about problems after, complications after the sleeve resection and after the gastric bypass, because problems like the links, not all time, but sometimes with the problems with diet before this medical procedures we do. All of patients must remember about this, must remember about diet before 5-7 days before this procedure. Must only drink water, tea, amamilla, maybe some natural yogurt, but not others. After these procedures, this is important too, for safety this patient and for safety these procedures.